1 month ago, Kootenai Health in northern Idaho was the first hospital in the state to start rationing care due to surging COVID-19 cases.
And health administrators there say a month later, things are only getting worse.
But as ABC's Morgan Norwood reports, new help could be on the way when it comes to protecting part of America's youngest population.
Children ages 5 to 11 are now one step closer to protection against COVID-19. Pfizer submitting its data to federal regulators for emergency use authorization for its child vaccine. If approved, it would be a major expansion that would curb serious infections in young children and help schools stay open. In California, parents protesting a plan that would require students to be vaccinated once the FDA signs off.
I came out here to support my right as a parent to make medical decisions for my minor children.
And in Los Angeles, a new sweeping measure requiring proof of vaccination or a negative COVID test for those with a medical or religious exemption before entering most indoor spaces.
Tamp it down and be done. The only way to do that is to encourage people to get shots or to assure that in our public spaces people aren't infecting each other.
As cities from coast to coast look to protect residents, President Joe Biden traveling to Chicago to tout the benefits of worker vaccine requirements. A new White House report showing organizations with those requirements increased vaccination rates to over 90%.
And we know there is no other way to beat the pandemic than to get the vast majority of Americans vaccinated. It's as simple as that.
It comes as another study from the CDC estimates that 140,000 American children were orphaned because of COVID-19, and 65% of them were racial or ethnic minorities.
Not only does it affect the child now in the short term, but it does really stay with them for the rest of their lives.
And as for those highly anticipated COVID shots for young children, the FDA is set to go over the data on October 26. An FDA authorization and the CDC's recommendations are expected shortly after that meeting, which means we could see shots for children ages 5 to 11 as soon as early November. Morgan Norwood, ABC News, Los Angeles.